one to tell you why that particular slide is there. So this particular slide, what I did first, I definitely in my class, by the way, I've been in that room after other professors have pinned their things, because that's how this happens. I mean, I'm assuming that most of you here, if not 100% of you, have taken a practical exam, because this is AP2, you did AP1. And you know how it works. You go in there and the room's set up and there's pins and things, and we just said, it's all point to name, that's all it is. It's a lot, but that's all it is. There's no solving problems or anything like that, right? Well, all of us use this guy right here, the mesenteric proper. So I like to start with that, because you're going to see that on the test. I promise you that. There is going to be a cat laid out there, and we're going to splay out, wait, what does mesenteric proper go? Do you remember this? I hope so. You took the quiz for it, right? It goes to, the mesenteric proper goes to the jejunum and ilium. It's what anchors the jejunum and ilium, and so that's what we do. We use these instruments, to, like hemostats and pins, and hold the jejunum and ilium spread out, and then we stick, sideways, we stick a pin through this stuff. That is mesenteric proper. You're guaranteed to see that on the test, so nobody should miss that. Now, remember there were other parts of the mesentery, and then there's mesoduodenum and mesocolon, and in my class I highlight these because I frequently will throw one of them in there also. I'll spread out the colon, and you'll look at the mesentery that's going to the colon, and you need to know that that's the mesocolon. Or you got this, what comes out of the stomach? Oh, the duodenum, or duodenum, whichever pronunciation you like. And so the mesentery that's attached to that is mesoduodenum. You should know all of these, all right? Mesoduodenum, mesentery proper, mesocolon. We don't do the mesorectum. That's kind of difficult to even to identify. You should know it exists, but we're not going to test you on that one. By the way, this mesocolon, particularly in my class, even if I don't use it as a test question, we know the artery that goes to that, right? You didn't study yet, right? What's the artery that goes to the mesocolon? Inferior mesenteric. That's another clue. That's another strategy that you have to use when identifying the arteries, which is what most students, AP2 students, have a problem with on the midterm. And then the final, the veins. Identifying which vein and which artery are we talking about. You identify these by what they are going to. So if we stick a pin in an artery that's going to the mesocolon, you should know that. That is inferior mesenteric. If we stick a pin in an artery that goes to the mesenteric proper, you should know that is superior mesenteric. That's how you identify those arteries. Now I'm going to cover that again when we do, because I got my artery things here. So I like to start with this because I'm giving you the first question. And like I said, I don't know if your professor's going to do it, but I will tell you this. I've been in that lab test room after other professors have been in there, and just about everyone that I've been in after has used that, this mesenteric proper. All right? If you don't know what that is yet, before you leave today, make me point it to, on the cap. Because I got my tray of cats over here, my quart of cats over here, and I will be doing it. I'll put my gloves on, and you can watch me as I'm doing it, record me as I'm doing it. But that's why I like to start with this. I also like to remind you, it's all the organs of the abdominal pelvic cavity, that's what this picture is for. This is more for me to remind you all. Anything that's in that abdominal pelvic cavity is fair game, with the exception of the reproductive organs, because we specifically cover that for the final exam. You're going to get the reproductive organs of the cat in the final exam. So what else is in there that's not part of the digestion? What about the kidneys? Yeah, that's definitely fair game. The urinary bladder, that's definitely fair game. The spleen, yeah, that's definitely fair game. And that's what I cover when I'm going to do this later on my cat. I'm going to say make sure you know the diaphragm. That's definitely fair game. We've all used all of those. Okay, I use every one of those, and I know other professors use them too. Okay, so this is to remind you, it's not just the digestive organs that's in the abdominal pelvic cavity. There is a chair over here. You can use my chair. I won't be using it. Salivary glands is on your test, and so we got this gal up there that guy, that gal. Yeah, that's on the test. All right. So there's only 3. Well, there's 6, right? Because there's 2 of each. There's only 3 though, really. And so you got the parotid gland, submandibular, and sublingual. You should be able to identify every one of them. I don't do the right and left on this, but some professors do. All right, so you should Well, that's easy. You know right and left, right? You know it's not your right and left, right? It's the patient's right and left. So even with the cats, I definitely do rights and lefts on the cats. They're your patient, so that's how you have to, observe them. Observe them as your patient, which is why you end up doing right and left on that thing. So what are they? Here we go. That's the parotid gland, the one, and you saw that in AP1 because I know you did this muscle, the masseter. Yeah, sitting on top of that is your parotid gland, and then underneath the mandible right there, that is under submandibular, submandibular. This happens to be left parotid, left submandibular. By the way, don't memorize it that way because we got a couple of those models, those torso models, and some of them are on the right, some of them are on the left that you can see them. You'll notice on this particular one on the right side, we can't see the parotid because it's been cut off. Of course it had one there, but they cut it off so you can see inside the oral cavity. And now that you can see inside the oral cavity, you know that guy there is the tongue. So what do we call under the tongue? Sub, and our word for tongue is lingual. Yeah, so there's the sublingual gland. Now, you know what confuses AP students on this one? That one right there, that's submandibular. Why? Because the mandible's missing. The mandible's been cut off, so don't get thrown by that. It's not all that difficult. KISS, K-I-S. Keep it simple. My father-in-law used to tell me KISS, K-I-S-S. This is how you spell it. Keep it simple, stupid. That's what he used to tell me. Keep it simple. It's underneath everything here. You shouldn't confuse that. Tongue, sublingual, submandibular, way down there. Just picture this the mandible that's been cut. It went from here to here. That was underneath it. All right? That's a trip-up point. So make sure you get that. This is on your midterm, this model. Okay. Then we got this tongue specimen, and you got the 3 papilla that we cover in this particular class. This isn't all of them, by the way. We don't do everything. This is an undergraduate class in anatomy and physiology, so I know there's more, but this is the one that you need to know here. Filiform, fungiform, and circumvallate. Filiform, fungiform, and circumvallate. This is the specimen. That's it. That is the specimen we use, and there's a tongue. Pretty gross looking, but that's the tongue, okay? So circumvallate are the one that's oriented in that V pattern over here, okay? So if we put a pin in any one of those circles there, that is the circumvallate. What about those filiform and fungiform? That's a little bit difficult. They're in the same area. They're in the anterior 2/3 of the tongue, and the filiform are a little bit finer and smaller, and the fungiform are a little bit bigger. By fungiform, we did that in my class. Fungus is what? A mushroom is a fungus, and that's what they look like. If you look at fungiform papilla underneath a microscope, they look like little mushrooms. And so somebody said, "Hey, this looks like a mushroom." Wait, mushrooms are fungus. So they call them fungiform papilla. Why are they big? Why do they look like a mushroom? Because they have taste buds in them. That's how we do this question on the test. If I stick a pin in here and say, what's the name of the structure in this region of this organ? If I don't tell you it's a tongue, you need to know that much. I hope you remember that much. It's the one with the taste buds, fungiform. And the ones without, filiform. So there you go. Those are your 3 questions, right? Yes, some of the other professors love to do this one over here. This guy over here is the epiglottis. I don't do that in my class because that's going to be on your final. When you take your final exam, we will cover the respiratory system, and the epiglottis is part of the larynx, which is it's a piece of elastic cartilage that is actually part of the larynx. So I don't cover it here, but I'm warning you, anybody that's not in my class, I know, I've been in that room. A lot of professors will use this epiglottis. All right, so make sure you know that. We do have a plastinated model of this. In my class, I'm always going to use this particular model. I just think the structures show up better. But if you want to see that later, it's back there. And if you're not in my class and you want to see the stuff on the plastinated model, I will gladly show you that later. Okay? But you got the same thing. Circumvallate, fungiform or filiform, and the epiglottis. That's pretty much what you need to know on this particular specimen. Then we do have a picture of this. Literally, this is the poster thing that we had. We had a whole bunch of these, and one of our lab specialists literally took one of them and cut that picture out. That pic of the tube. It is exactly the same as this, without all of this around, of course, because that's what the answer. So we put that on the table. We laminated it. We put it on the table. We put stickers on it, 2 stickers on there. And so what are the structures that we use on that? Well, any part of the tooth that is above the gums or the gingiva, that is called the crown. Any part that's above the gums or gingiva, that is called the crown. But if we point to that and we ask, what's the white of that part? That is the enamel. The enamel is the white stuff. That's important in medicine. All your people over 60 years old, we don't make. You know this thing's alive. Do you know that? Of course you do. There's blood vessels there. Why would you have blood in something that's not alive? We have to replace that enamel. And when we get old, we don't do it so well anymore. Yeah, all of those beautiful tooth white, they don't work on old people because we don't make enamel. If you don't have enamel, you're not going to make it. Believe me, I try. It doesn't work. Dr. Citron, how can I get my teeth nice and white? You can't, Dr. Stefano. It's done. Get used to it. You're old now. I'm 70 years old. It ain't happening. That's okay. I could live with that. The white stuff is the enamel. The top piece is the crown. The piece that goes down into the bone there, that's the root. I personally don't do that on the test because it gets rather confusing for students. What are you pointing to? Do you want this thing here, or like the root canal? That's what's in the center of that. That's the root canal. It's not that procedure that dentists do. Yeah, they call it a root canal. That's when they clean that thing out. But that is the root canal. The root is the piece that goes in there. And the yellow stuff is the dentin. That's why we have that gum out there called dentine. It's named for the dentin, the material. And in this chamber right there, where the blood vessels are, actually there's nerves in there too. That is the central pulp cavity. Recap, what do you need to know on this picture? The crown, the enamel, the central pulp cavity, the dentin, the root, and the root canal. That's it. Two of those will be on the desk. Two of those will be on the desk. Then we're going to do the stomach. In the cat, you don't need to know the specifics, but I guarantee you there will be a cat where there'll be a pin in the stomach, and your professor will ask you, what is this organ? And they look so different from one cat to another. So if you haven't experienced different cats, I feel for you, because you're gonna trip yourself up on this. But you need to know the stomach. Now in the human, we do have the beautiful specimen over, and these things are real. I don't know if you know that. If you touch them, you're touching their stomach. There was a person that walked on this earth, and that is their stomach. I get excited. This is cool. That's cool stuff, that you can actually pick up somebody's stomach. Same thing with that tongue, too, by the way. So you need to know the regions. What are the regions? The cardiac region, the fundus, the corpus is the body, the pylorus. I don't do corpus, by the way. The other professors might. It gets kind of complicated. Do you want the fundus here or the corpus? So I don't even, that's too complicated. By the way, corpus just means body, right? In legal speak, the corpus delicti, you've heard that. What is it? Body of evidence. That's all that means. Corpus means body. Oh, you did it in AP1. Corpora quadrigemina. What's corpora? Body. Quad. 4. The body with the 4 mounds in it. That's why it was called the corpora quadrigemina. If you were in my class, I told you that. You probably forgot. But corpora just means body. Okay, so where's the fundus? Superior lateral to the left. It's above. Superior lateral to the left. By the way, in gastronomics, I forgot those gastroenteritis, that's where most gastric ulcers are, up there in the fundus. Cardiac region, that's where the esophagus attaches. That's where the cardiac region is where the esophagus, and pyloric, that's where it empties. So physiologically, there's a lot of different things going on, and that's why the stomach has these different names for all of these different regions. Now you have to be able to identify them if we point to that. So in my class, cardiac region, fundus, pylorus. One of them is going to be on there. We get 3 questions on that specimen, by the way. Cardiac region, fundus, pylorus. Then you got the structures there. Cardiac sphincter is kind of hard to point to. I don't generally do. I did it once. I don't do it anymore because it's something in there. And it's our wet specimen's kind of been destroyed. That's our fault. But they're old. It's not really our fault. When I came here 8 years ago, Gary told me those things are 25 years old already then. So they were over 30 years that we've had them. That's pretty good that we still can maintain them that long. We try to order new ones, and it's kind of hard to get. That's why we have a whole lot of plastinated models now. But cardiac sphincter, that's the valve between the esophagus and the stomach. Pyloric sphincter, I love that one. That one shows up very nicely on both specimens. We have a plastinated one, and we have the wet one. That's just the circular muscle that controls the emptying of the stomach. and that's the pyloric sphincter. And the ruga, yeah, I did say ruga. Ruga is the singular, rugae with the E on the end is the plural. If you don't remember that, Latins, they don't, in the Latin language, to make something plural, they don't put an S like we do. You know, you got one hip, so if you talk about both, you call them hips. And no, you got one hip is coxa in Latin, and two hips, coxae, with an E on the end. The E on the end means the plural. So this, what is this? These are the ridges inside the lining of the stomach. Okay? Those are the rugae. So here it is, that's the specimen, that's the wet specimen. Here's where the esophagus is going in, so this region is the cardia. The cardiac sphincter is the circular muscle that's right there. This is turned sideways a little bit, so this is the top, and that's the fundus. If you need to know corpus, the main part of the body here, that is the corpus. The ridges inside here, those are the ruga or rugae. The area where this thing is starting to funnel down, that's the pyloric region. And right where that valve is right there, that's it there, there's the circular muscle. That is the pyloric sphincter. And that's pretty much what you need to know for this. This is kind of cool because you can see the duodenum here and the piece of the pancreas and all of that. And a piece of the what? Greater omentum that hangs off the great curvature of the stomach. But that's just all FYI. You're not going to get tested on that. You're going to get tested on the things I just pointed to. We do have the plastinated model on this, and so you're there. There's your esophagus where it's going in, cardia. Okay, and then you got the main body of this is the corpus, and this area up here, fundus, yeah. And where it's getting narrow here, yeah, not very narrow, it got all stretched out, but that's the pyloric region before it empties. So if this is pyloric region, what's that? I love this one. I love that. It looks like a little anus. Go look at it if you don't believe me. That is the pyloric sphincter. That's the pyloric sphincter right there. And so that defines what it looks like. Inside the stomach there, you can see the folds. Those are the ruga or rugae. The sphincter of the, cardiac sphincter, that's up in there in this particular model. So it's kind of hard to see that one. But that's the structures. Then we move on, and in the cat, you do need to know duodenum, jejunum, and ileum. You need to know all three regions of the small intestines. But when it comes to the colon in the cat, that's it. That's as specific as anybody gets. And that's because to point to those structures, we actually distort the actual natural anatomy of the colon in the cat. We have to, God bless you, we have to pull it out and stretch it out. So anatomically, it's not in its correct position. And I don't think that's fair, and neither do any of the other professors to make you identify those. But these we can do pretty easily. If I point to the small intestines just after it comes out of the stomach, that's the duodenum or duodenum. If I point to the small intestines just as going into the colon, that has to be ileum, because that's where. And if I point to the small intestines and just ask you, what is the middle segment of this structure? You should know that's jejunum. So that's all fair game in the cat. What about this ileocecal sphincter? Not in the cat. We don't cut them out so you can see the ileosphincter in the cat, but we do have a human specimen for this. The specimen's title is called the specimen of the cecum. And so what's on there, we have the cecum, we have a piece of the ascending colon, we have the ileum going into it, and we cut it open so you can see the ileosphincter inside there. And it also has that appendix hanging off of it. So on the human, we get a little bit more specific just in that one specimen. We do see a piece of that ascending colon, and we do see the ileum. But as far as jejunum and duodenum in the human, not really. We don't do those. Again, the colon, you got the cecum is the beginning of the colon. It's just a piece of the pouch that's there. The appendix hangs off of that. I do not do Hashimoto's coli, but I caution any of you that have other professors, they do test you on that one, on that specimen. I think it's a little obscure. It's not that I don't think they're important, but I quizzed on that. I put those questions on my quiz, so I know my students know it, or got it wrong on the quiz if they don't know it. But I don't put that on the test anymore. I put appendix, or ascending colon, or the cecum, or the ileum, because the ileum is on there, and that ileocecal sphincter. So your list here is cecum, ascending colon, appendix, and if you're in another professor's class, Hashra and Peniacola, And don't forget from the last slide, we talked about that sphincter, ileocecal sphincter. You just put the names together. Went the wrong way. So there's your specimen. This is a human and just like all the other human specimen in here, there was a person that walked on this earth, and that's their. We got two of them, by the way. One's a big dude and one's a little dude. Other than that, they're pretty much the same. We do have the plastinated model of this also, but they, again, just like the stomach, we didn't cut it open, so you're not going to see the sphincter there. What's this stick going through? The ileocecal sphincter. What's this? Ileum. What's this? Cecum. What's that? The appendix. And what's this? The ascending colon. The pouches that are up here are haustra, and that band, that thin band there is tenia coli. Where's that word come from? Tenia coli. Tenia sounds like tendon, right? Yeah, tendon-like. What's coli? Coli just refers to the colon. See how simple it is? Why did they make this thing so complicated? No, you're making it complicated. Coli is the plural of colon. That's it. When you hear coli, think colon. Tenia coli, the tendon-like band, and unfortunately, they're not tendons at all. They're smooth muscle. There's 3 smooth muscle bands that run longitudinally along the colon, and we call them tenia coli because they kind of look tendon-like, but they're not. They're smooth muscle. The names are easy. Don't complicate things, okay? Once more, let's recap. Ileum, cecum, ileocecal sphincter, appendix, ascending colon, and for your other classes, haustra and tenia coli are up there also. This is the plastinated model of this. We're not going to see the sphincter because it's inside there, but there's ileum, cecum, appendix, ascending colon. This would be the good one to use for those haustra and tenia coli because they show up so nicely on this. But I don't use that. We only get 2 questions on this, by the way. So I'm not going to use it for haustra and tenia. Other professors do. I've seen them use that. So make sure you know that if you have another professor. Then we have a beautiful liver specimen. I do not, and I don't believe any of the other professors also make you know the lobes of the liver of the cat. But you will definitely see a pin in a liver of a cat. And we will ask you, what is this organ? You need to know that that is the liver. And boy, do they look different from one cat to another. Some cats, they're tremendously big and they're brown. Some cats are much smaller and they're green. I don't know why, but well, maybe because we look different on the outside. We also look different on the inside. They also got that little ball, balloon-like thing, right? It's a deflated balloon. What's that thing called? Gallbladder. Don't forget the gallbladder. Okay? So you need to know in the cat, the liver and the gallbladder. On the human, yeah, we need to know these 3 lobes. We don't do caudate lobe only because, let's look at the picture. The caudate lobe is underneath all of this mess, right? And it's not a mess. It's good stuff. By the way, this is the portal artery and portal vein and biliary ducts. That's all kind of covering the caudate. The caudate lobe is underneath all of that. But the other lobes we can see. What's the one on top? Well, it's not on top, is it? Yeah, this is upside down, right? You all know that, right? This liver has been turned upside down, so everything that you see up here in the body is the other way around. Everything that's up here normally is down lower. And so that's quadrate lobe, and there's the gallbladder. So the gallbladder kind of dips down a little bit and hangs inferiorly. So there's the gallbladder, there's the quadrate lobe, right lobe of the liver, left lobe of the liver. Why didn't they flip this the other way? Because of all of this stuff here. They wanted you to see how this all enters into and connects to the stomach and the spleen over here. But I'll talk about that later. What was on your list? I just went backwards again. On the human, we do know, you need to know these the duct systems. The hepatic, the cystic, and the common bile duct are on that specimen. You should have learned that cystic means gallbladder. To get a cystectomy, a cholecystectomy means ectomy means to cut out, means to remove the gallbladder. And you know hepatic. Why would you know that? Because you know about that, and people have Hep A, Hep B. What's Hep a short form? Hepatitis. What is hepatitis? It's an infection of the liver. That's why it's called Hep A, Hep B, Hep C. So hepatic duct is one that comes out of the liver. Cystic duct is one that comes out of the gallbladder. They come together. Common bile duct. Well, that's a good name for it. I would even name it that. That's easy. So there they are on the specimen. Gallbladder, coming off the gallbladder. Cystic duct. The one that's coming out of the liver right there. It's kind of hard to see on this picture, I understand that, but we got it back here. If you still need help seeing that, you know, I'll help you. Call me over there and I'll point to this stuff. Gallbladder, cystic duct, hepatic duct, they come together, common bile duct. The lobes, by the way, right lobe is always the larger one. The right lobe of the liver, left lobe of the liver, quadrate lobe of the liver. So we're kind of done. One more thing. I don't know why. I love affair with this guy over here, the spleen. When are you ever going to see a human spleen again? I would urge you all put some gloves on and hold that thing. You could really hold a real human spleen. You won't do it. I know you won't. I didn't do it. That's how I know you won't do it. Okay, but that's the spleen. That happens to be the gastrosplenic ligament here. We do have the stomach here, the duodenum, and a piece of the pancreas all on here too. So, you know, you learned about this duct system, how the common bile duct joins the pancreatic duct, and how that has a hepatopancreatic duct that goes into the duodenum. You're all looking like, what's he talking about? Yeah, we covered it in class, okay? You can see all of that on this specimen. If you bother to put some gloves on and look at it, lift it up, look underneath there, you're allowed to do that. Just be careful, don't break it. There was 4 questions on this one, by the way. 4 questions at this station. So there's more to know, yeah.
Is that just the 4 questions like on the liver part or going down
Okay,
to the
I don't
bottom
put,
of
some of the
the
professors will use this. They'll use the duodenum, the pancreas, so that's up between you and your professor. I don't. I only have 4, and I already wasted one on this, like, you know, identifying the spleen. So I only have 3 left, and I'm going to focus on the liver and the gallbladder and duct system.
So where's the pancreas?
It's this little piece, it's hard to see on this thing, right? But there's this stomach, there's the duodenum, and that little piece right there, there it is. That piece there is the pancreas. And they are labeled over there. So, you know, look at that before you leave. This is the gastrosplenic ligament, which you should be able to figure that out. You all have been given enough information to figure that out. Yeah.
And it's going to be in the posterior view, correct? Correct.
Yeah. Yes. Just like it is right there. Matter of fact, after we're done doing this review today, if you haven't been told yet, your midterm exam is in 223 right across the hall. So when we're done here today, this is it. This is the last chance to see all of the specimen, because I'm taking my cart and they're all going over there and we're setting up the test. Now, professors, each individual professor moves pins around, but the stations are set up. They're all set up. I help the lab specialist. Actually, it's the lab specialist that usually sets that up. But all the cards are out there already with their menu for the answers of the questions. It's all done. It's all done. Now we just have to carry the specimen over there. I even have the cats already out there that I know I'm going to use. I use really good dissection of cats to make it. It's to help you all. The idea here is to test you, not to try to trick you. Okay? The idea. Matter of fact, Dr. Willis always tells me, "You made this too easy. God, this looks good. This dissection looks too easy." I go, "Come on, they're not doctors. That's not what they're here for. This is undergrad." And he goes, "Yeah, you're so cool." So he's cool with it too. But 4 questions on this specimen, just like this. Just like this. We'll be carrying that thing over into the other room. Yeah, if you didn't get the message, mesenteric proper is always on the test, right? Always. And the artery that goes to it. Wait, what's the artery that goes to the superior mesenteric? Goes to that. That's how you identify arteries, by what they're going to. This is just some pictures. I'm gonna flip through these pretty quick. I just need to remind you of some of the things that you need to know. There's the diaphragm. There's the gallbladder. I like to call it, by the way, the deflated balloon. It looks like somebody took a party balloon and stuck a pin in it, and now it's just sitting there, right? And there it is. The deflated balloon is what? Gallbladder. And what's this whole big thing here? Liver. What's the middle segment of this? Well, it's the small intestine, so it's jejunum. First segment, duodenum. Last segment, ileum. Yeah, see, that would all be fair game on this test. That's about all we're going to see on this particular specimen. And so there's the liver, there's the gallbladder. Diaphragm's missing on this particular, there's a piece of it there. Oh, kidney, let's not forget kidneys. Oh, and yeah, right and left. So which one is, that's the right kidney? Okay, that's particularly important later. Right underneath the liver, there's the stomach in this particular cat. Over here, that's the, why is that the spleen?
Below the stomach?
Because, huh?
Below the stomach?
It's actually to the left of the stomach, isn't it? It's not really below the stomach, it's to the left of the stomach. It's not because it's dark, it's not because of its appearance, it's because of its location. It's in the left lateral gutter. Not all spleens look like this. Some spleens are look, as a matter of fact, they almost look identical to this. And so spleen and pancreas are the two that's easy to confuse, unless you remember the location. The left lateral gutter will always be the spleen. Underneath the stomach, and this is why the only reason why I wanted to correct you, underneath the stomach, that is the pancreas. Okay, so if we lifted the stomach up and we use one of those little pins that are in there that has the wooden handle, and we're holding the stomach up and we point to an organ that is directly underneath the stomach, you don't care what it looks like. You know what it is. It's the only thing that you learned that's underneath the stomach down there. There's other stuff, but you don't have to concern yourself with that. It's the pancreas. That's the only thing that you learn that's underneath the stomach right there. That is the pancreas. By the way, this is why most people with pancreatic cancer get what? That back pain. It's in their back right there and underneath their stomach. They get that cramp and they bend over. It hurts right into my, that's because of its location. Spleen, left lateral gutter. That's where the spleen is, okay? Okay, coming out of the stomach, the duodenum, there's your, jejunum and ileum. There's the colon. Remember that the cat does not have what? Hashimoto's coli. So their colon looks real smooth. So how do you differentiate? The size. I know the pictures don't do it justice, but the girth or the diameter of the colon will be twice as big around as the small intestines. And it's obvious. You won't confuse it, I promise you. Okay? I love this picture because I need to really make you understand, just like cats and humans look different on the outside, they also look very different on the inside. Have you found the stomach on this particular cat? The liver. Look at the liver in this cat. God dang, that thing is huge. And there's the gallbladder in this cat. And that's it. That little rim right there, that is the stomach. So that's basically what's underneath the liver. That's the stomach in this cat. And look at the color, and look at the size, and look at the texture, and now look at that guy. Dang, that's a fat cat. That's the stomach in this cat. It doesn't matter that they look different. You have to be able to discern which one is the stomach, which one is the liver. You can see why I don't do lobes of the liver, and most of us don't. They've got 5 lobes, and generally you can't see all 5 lobes at once. In this particular cat, it just so happens we can see all 5 lobes, but most of the times you can't. And you are not allowed to touch anything on this test. If you don't like the view and you want to move things, please do not. In my class, I take points off your test for doing it. Why? Because the pins are in there, and if you mess up that pin, that means everybody behind you now could get that question wrong because of you. I literally had that happen to me in one of my undergraduate courses at Stony Brook. And I complained to the professor. He goes, so what? He didn't care. And I lost the points. So that makes me mad. I'm going to take it out on you. I take it on anybody that touches the stuff. Don't touch, okay? Don't touch. Don't be that 2-year-old, right? Bring your kids to the store. Don't touch, and they're touching everything. Don't touch. I don't want you to mess up other students. So I do it to protect all of you, okay? Don't touch. Now, if you do need a different view, in my class, if you raise your hand, can I see under that? Can you move that? Yeah, I'll do it. Because if I move the pin, I can fix it. I know where it belongs. But you can't, okay? So there's the stomach, there's the liver, and blah, blah, blah. The spleen, left lateral gutter, spleen, left lateral gutter. The pancreas would have been underneath the stomach there. So I only put this up there to make sure you can understand. Don't be upset because they look different. They will look different. You'll be standing there. I can't tell you how many times I've seen this student go, my cat didn't look like this. Yeah, I know it didn't. It's okay. This is still your test. You still have to be able to do it. Is that what you're going to tell a patient when they come in? I'm sorry, my other patients didn't look like you. You need to believe. Okay? You can't do that. You still have to be able to identify this stuff. Here's kind of my list. I haven't done the mentor yet. Yes, we always do that one too. That big fat stuff that's here. I want my omentas hiding my abdominal muscles very nicely. Never seen my abs. Maybe not. My brother did. You can see his six pack. That's the omenta, greater omenta. Liver, stomach, duodenum, jejunum, ileum, spleen, gallbladder, diaphragm. These are all fair game. Cecum, colon, urinary bladder, kidney. Did I miss anything? Pancreas. Don't forget pancreas. This is to kind of take a break. I don't know why I threw this in there, just because it's cool. That's not a cat. That's human. That's a cadaver. That's a human cadaver. And this is why we study cat. Even though you study cat, you can name everything on here. Yeah. It's diaphragm, liver, gallbladder. The color's really different, but gallbladder hangs down low. Stomach, greater omenta, spleen. Pretty much the same. A little different, but pretty much the same. Then we do the heart. These are the most frequent questions, other than the cat stuff, missed on the midterm exam by AP2 students, and it's the coronaries. And they are so extremely important. You have to be able to identify the first two major coronaries, right and left. And not so much left, by the way. We never point to the left because it's kind of hidden. It's hidden underneath the pulmonary trunk. Then we got the branches of the coronaries. On the left side, you've got anterior interventricular branch of the left and circumflex branch of the left. Then you've got marginal branch of the right, posterior interventricular branch of the right. We challenged you. We challenge you by putting the wrong choices on there. We don't generally do that. But that's the importance of coronaries. The number one killer of adults in this country is heart disease. And what's the number one cause of heart disease? Coronary artery disease. It's, you know, even if you decide not to go into medicine, I don't care what you're doing. It's important to your body. It's important to you. It's important to your family. It's important to your health care and the health care of your family. You should know about your coronary arteries. You have to be proactive in your own health care today, particularly. Doctors can rush you through because they have to. That's the business of it. But you should double check their stuff because they're going to miss things. So one of the choices will say anterior interventricular branch of the right. One of them will say circumflex branch of the right. One of them will say marginal branch of the left. One of them will say posterior interventricular branch of the left. Those are just wrong choices. So make sure you get these down and get them down cold. Coronary sinus is on that one model. Some of you I was showing before class, but if you haven't seen it, that's okay. I'll show it to you later. These are the specimen that we use for that. These are beautiful specimen. When you first come to this specimen on the test, you need to get oriented. What are we looking at? Front or back? Wait, no, anterior or posterior? Is this an anterior view or posterior view? This one here is anterior view, and this one here is posterior view. How do you do it? I don't know. Whatever works for you. I use the pattern of the blood vessels up top. That's what works best for me. If you can see ascending aorta and pulmonary trunk, that's the front. That's anterior. If you can't see them in that fashion, if you see inferior vena cava, if you see the aorta coming at you after the aortic arch, that's posterior view. Okay. So anterior view. There's the right coronary. The left coronary, by the way, is behind this pulmonary trunk. If you look at that real carefully over there at the specimen, you can see it in there. So obviously, we're not going to stick a pin in that thing. It's just too hard for us to do, number one, and number two, for you to discern that that's what we want. So, but right coronary, there it is. It's in the coronary sulcus. This is the marginal branch of the right coronary. Right coronary, marginal branch of the right coronary. Now, we can't see what this came off of, but we know by intuition what this is. We know it is in the anterior interventricular sulcus, which means it is the anterior interventricular branch of the left coronary. This one comes off the left. And that's fair game on your test. Flip this guy around, look at it from posteriorly. There's the right coronary as it came around from the anterior. There's the posterior interventricular branch of the right, and there's the circumflex branch of the left. Here is the opening of the coronary sinus. They cut the coronary sinus out so you can see something flex branch better. That tends to cover that. There is the gap that had, in the coronary sulcus, that is the gap that used to have the coronary sinus in it. That's why that big gap is there, because they cut it out. On the other specimen, it's not cut out, and I'm sorry I don't have a picture of there, but that is old coronary sinus right there. You can see it better. You need to look at it before you leave today. This is your last chance. Like I tell you, when everybody leaves here today, I'm moving, all of this stuff goes over. You cannot go next week and look at it. You can look at pictures of it, but that's about it. Okay? So this one will also be on there. Anterior interventricular branch of the left. Coronary sinus. We can do a posterior view of that. I don't have pictures of it. You know what? Look at it over there. And if you need me to show it to you, I will. Okay? I got no problem. I came in here on a Saturday. That should tell you something about how I feel about this. This is the other specimen we use. I used to use this for coronaries, and you can see not a whole lot of them show up, but that's all we had. Now we have beautiful specimen for that. So that is pulmonary trunk. That's ascending aorta. That is the aortic arch. The three branches of the aortic arch. This is human, yes. Human has three. So that is brachiocephalic, left common carotid, left subclavian. I apologize the way this picture was taken. I need to redo this, but there is two branches off of this. And if you don't believe me, go look at the specimen over there. You will see right subclavian and right common carotid. Remember the pattern that goes across the top. The two subclavians are on the outside, the two common carotids are on the inside. Come on, that's just common sense. Carotid arteries are in your neck here. You feel that pulse, that's your carotids. Subclavian, what the heck does that mean? Sub means under. Clavian is clavicle. Dang, that's easy. See how easy this stuff is? Clavian, it's underneath the, so where's that going next? Oh, axillary brachial. It's just a continuation of. Do not forget pericardial sac on this. This is to remind you we have structures inside the heart that you also need to know, like the chordae tendineae. Where did the chordae tendineae come off of? The papillary muscles. The chambers, you got right and left, atria, right and left, ventricles. Why is there right and left? The interatrial septum, the interventricular septum. What about those AV valves, atrioventricular valves? Yeah, you need to know what side they're on. And you need to identify right and left. So how do we do this? We got a sheet part for this. In my class, I only do 2 from this. The rest will be from human. I believe every other professor's doing that now, too. We used to, if you look at the original breakdown, it was 6. But that's because we didn't have those beautiful human heart specimen that we have now. So where's right and where's left? This is not that, you know, what you did if you weren't, you turn around because it's the, no, you can't do that. This thing has been cut in half, and now this is upside down. This is flipped over. How do you do that? The side with the thick wall is which side? Left. Yes, that's how you do that. That's how you do that. Don't forget to do that. I do get every so often students forget to do that. So when I point here and say, what chamber is this? That's not the right ventricle, that's the left ventricle. You would have called that on the right side. That also changes everything else. This is left ventricle. What is that structure? It's the valve on the left side. So that's mitral or bicuspid. What's this chamber? Left atria. Right atria, right ventricle. That's the valve. Please, you need to know what the valves look like here. I do get students raise their hand. Is this the valve? I can't tell you that. That's what you're supposed to know. Okay? You need to know it. If you haven't looked at this yet, then you might not know what the valves look like. And if you need my help, call me over there. Is this the valve? That now I can tell you. I can't tell you that on a test, though, nor will any other professor. Okay, valve on the right side, tricuspid. What's this? And then this, and this, and this, and this, and this. Well, those are all papillary muscles. Why did I point to all of them? Because I'm going to pick one on the test. I don't know which one I'm going to pick. Does it really matter? It shouldn't. The papillary muscles are the muscles that come off the ventricular walls and then have these cords attached to them. And the cords go to the leaves of the valves. That's what defines them as papillary muscles. This muscle here does not have the cords coming directly off of it. This is separating right from left. So this is the interventricular septum. This is the interventricular septum here. On the sheep heart, I don't do interatrial septum. I also don't do the aortic semilunar valve. Some professors do, but I don't. Check with your professor whether or not he wants that. Okay, I think that's a little bit too much. But on the human heart, notice we can see interatrial septum and interventricular septum. And it's just because of the way the cart was cut in half. That's what makes it different. Every other thing is the same. So what's this? This is right side because that's thinner. This is left side because it's thicker. What chamber? Left ventricle, left atria, right ventricle, right atria. It's right side, so what's that? It's the valve on the right side, tricuspid valve. What's that? It's the valve on the left side, so that's bicuspid or mitral. What are these? These are the papillary muscles. What are these cords here? Cord A, tendon A. There you go. You got it all. Okay? You will have a tracing of an EKG on there. So you do need to know the waves, the P wave, QRS complex, and T wave. You all realize by now, right, that that's just the alphabet in the correct order: HIJK, LMNO, P, Q, R, S, T. What was the reason? Why'd they start with P again? You don't remember? I don't remember either. You looked it up and told me too. You looked it up in class because I never remember why they started with P.
He used A on a different.
Yeah, that's right. They used A for something else, so he wasn't going to start with A, but I don't know how he came up with P. Yeah. But we start with the letter P. What does it represent? Well, what does it all start with? The SA node, right? And what does the SA node do? It depolarizes the atria. So that's what the P wave is, this atrial depolarization. Well, what does that go to? That goes to the AV node, which goes to the bundle branches and Purkinje fibers and bundle of His, right? And all of that. And so what does the QRS do? It depolarizes the ventricles. Yeah, and you need to know that because those are the choices on the test. We're going to point to one of these waves, and you have to find the choice for the name of the wave plus what it represents. That the P wave represents atrial depolarization. QRS represents ventricular depolarization. And that T wave represents ventricular repolarization. Things have to repolarize. We do not see the repolarization of the atria, and on my students, the quiz, they got why that was. It's just hidden. It's underneath the QRS complex. This is the actual picture that will be out there. Some professors do use a single heartbeat, but I use this one. And I will point to two of the waves, and you have to tell me which wave am I pointing to and what it represents. Some of the representations will be wrong, so you have to make sure you know this. And this is pretty simple CPR. This is not advanced CPR at all. Okay? Now the arteries. Now, there are some arteries on these cats that are like really, really small. And so I never use them, and I know most of the other professors won't use them also. But the big ones, these are all there. The aortic arch. The two branches, yeah, cats only have two, right? Are the brachiocephalic, and way down here is the other one. The brachiocephalic, left subclavian, these are all fair game on this test. And then you got the branches of the brachiocephalic, right subclavian, right common carotid, left common carotid. Those are all fair game. Okay, you will see every one of these probably on a test somewhere. I don't use any of these branches of the subclavian, so right and left are the same, but you got this IVCT thing going on here. That's my acronym or acronym, I should say, more correctly. IVCT is the internal mammary vertebral causal cervical thyrocervical. Check with your professor whether or not he goes that detailed on your midterm. I don't. Not on the midterm. When we do veins, by the way, they will. Their representative veins will be on there. They're not the same names, by the way. But you'll see that. You're lucky we don't put veins and arteries on the same test, because that would get rather confusing. They're not the same. So check with your professor whether or not, these are not on my midterm exam. Now the branch of the subclavian, it's not really a branch, right? It continues as, underneath the clavicle, then it continues as axillary. That's fair game. That is definitely fair game. And then the axillary becomes what? Brachial. So this becomes the brachial, but before it becomes a brachial, VLS is the branches for this. Ventral thoracic, long thoracic, and subscapular. Ventral thoracic, I don't do anymore, but long thoracic and subscapular, I've done both of these. And I've done long thoracic even more frequently than I've done subscapular. And that's because this one is so long, when we dissect the cat, pull that flap out, it's still attached. It stays attached, if we're careful. And so on your test, if your professor points to an artery that goes out to that flap of skin that's been pulled out, that is long thoracic. It's long. So there's your clue. If you see a long artery going to this flap of skin that's way out there, just look for the choice that says long. And you've got your answer. Remember, how do you identify these? Where is it going to? So where is this going to? The scapula. You all know that because you took AP1. Where's your scapula? Back there. So that's where it's going. If you see an artery come off the axillary region and go down into the back, there's only one thing it can be. Subscapular. Because it's going to the scapula. So that's your upper arteries. Most of the arteries on your test, by the way, will be from the lower half because we have much more of a selection. There's 12 artery questions on your test. It won't be 6 and 6. Nobody does that. Nobody does that. It'll probably be more like 4 and 8. 4 from the upper half, 8 from the lower half. Okay? Why? Because we have a much larger selection. If you want to use this picture, you know what? This doesn't help you. It does look kind of pretty when you look at brachiocephalic. It kind of looks like a tree with its major branch limbs going up there. But you know what? The pictures just don't do it for you. You need to. I'll point to them on this, on my cats, right when we're done. Then we got the lower half. The branches of this, you got the abdominal aorta. And that's what I go with, and I believe all the other professors do also. It could be also called the dorsal aorta or descending aorta, but we go with abdominal aorta down here. And so you got the celiac trunk or celiac artery, superior mesenteric. I don't do adrenal lumbar, and I don't believe anybody else does. Again, when we do the veins, you will definitely get the adrenal lumbar vein in the cat, because they're big and they're easy to see. But let go back. Celiac trunk, superior mesenteric. We're going to skip over that. Renal. The genital ones, again, we'll do that in the veins. We don't do that now, but inferior mesenteric and iliolumbar. Iliolumbar, break the word down. You know this. You know this from AP1. Ilio refers to the ilium, which is what? The top bone, the superior bone of the os coxa. You're all going, oh my God, I thought I could forget this bone stuff, right? No, yeah, that's where it is. And so what's it going to? Iliolumbar. What's that reference? The muscles, the back muscles. I like to call it chicken breast meat. That's what it looks like. If you played with your cats and poked it, you will say, hey, that looks like chicken breast. Yeah, that's the low back muscles. That is why it's called iliolumbar. It goes to the lumbar muscles way down low by where the ilium is. That's the name. That's why. It's not just pulled out of thin air somewhere. Okay? Inferior mesenteric. I gave you hints. What's that going to? In my I literally stretch out the colon and point to the artery that's going to the mesocolon. That's your answer, inferior mesenteric, if it's going to the mesocolon. Renals, come on, that's easy. You got that. And nobody gets that one wrong, so I'm not going to spend too much time. The kidneys. But you do need to get that right and left thing down, right? And don't forget how to do right and left. Nobody's going to tell you that on the test. And superior mesenteric goes to the mesenteric proper. Now, there's some dissection that has to occur to make this happen, and I do it. And every other professor goes, I set the cats up because I love doing that stuff. Part of my adult life was to be a podiatric surgeon. So I love this. This is cool to me. It brings back memories of cutting things up. I'm weird, I know. No, I'm not a serial killer, but I like cutting things up. They're dead already, so it's cool. But I make sure you can see it going to the mesenteric proper. If your professor points to an artery, or if I point to an artery that's going to the mesenteric proper, that's your answer. You have to confirm that. So what's this one all about? Did your professor, I do it in my class, what's celiacs refer to? You've all heard of this. You've heard people have that disease out there called celiacs. You know it as a gluten problem, right? No, it's a lot more complicated than that. They actually have an autoimmune disease, and digesting gluten is just a part of it. It is a part of it, don't get me wrong. The gluten problem, it is a part of it. But they also make antibodies against their own digestive system organs up there. Which is like what? What's up there? Well, your pancreas, your liver, your gallbladder, your spleen. No, not the spleen. The stomach. They have celiac problems. They have digestive system problems. They have digestive system problems. So what's the clue here? What does this artery go to? The organs of the digestive system up there, which is what? The stomach, the liver. The spleen has to get thrown in there because it's right there. It's locally located next to the stomach. You got the ligament that connects the two. The pancreas, the gallbladder. That's why that's celiac trunk, because it goes to those organs. Okay? Why am I spending too much time on this? It's not. There was one test, there was one midterm exam where I pointed to the superior mesenteric artery and like 30 to 50%, I forget the exact number, of my class. And these were students that I knew, they spent time with me, I knew they knew this stuff. They were all putting down that it was the celiac trunk. It baffled me so much, I went back into the room to look at the cat and say, what the heck, maybe I marked this wrong. And I didn't. What happened was the celiac trunk was broken. On the particular cat, on that test, the celiac trunk was broken. What they did is they quickly went through and they said, this is the first branch, and so it's celiac trunk, because their celiac trunk is the first branch. You can't do that. That's not the way to do this. Surgeons don't do that. First of all, you can't count every branch in surgery. You identify arteries and veins by where they are going to and what they are coming from. If it is going to those organs, now you have confirmed the stomach, the pancreas, the liver, the spleen, then you confirm that is celiac trunk. But if it is going to superior mesenteric, it's not celiac trunk. It is superior mesenteric. It's mesentery proper that it's going to. All right? So make sure you identify where it's going to. That's how you identify arteries. Keep that straight. I almost wanted to give them the points, but then I looked and I did just like I told you. I spread out the intestines. You could see a mesentery proper, and you could see the artery going to it. And no, I didn't. And it didn't make a difference because they were all good students. Otherwise, they all still got an A in their class anyway. But they did learn. They did learn that lesson that you don't identify arteries that way. Okay, now we're down past the iliolumbar. You got external iliacs. These are the next two major branches. One goes towards the right leg, one goes towards the left. Then you got the next branch is off the abdominal aorta. These are smaller, internal iliacs, and they go straight medially. And then right down the center, the abdominal aorta continues and goes to the tail, and that is called the caudal. Okay? I will tell you this. Every one of these has been on a test. Every one of these is that has been, will be in my class. Every one of these will be on a cat somewhere. Every one of these. So these are important. They're easy to see. The caudal is deep. It's going to the tail. If one's broken, it shouldn't matter to you. If there's an internal iliac broken and I point to the caudal, you still need to know that's caudal. It's the one that's deep. It's right down the center. It's going to the tail. Okay? So you have to be able to identify all of them. We come back to the branches of the external iliac. The external iliac is still inside the pelvic cavity. As it exits, it gives off one more branch. This guy's pretty small. It's a lot different than humans, by the way, but this one's really small. In humans, this is kind of big, but it goes straight medially. And it's a small branch, just as this thing, external iliac, is exiting the pelvis. If we point to a branch that's coming off the external iliac as it's exiting the pelvis, that is the deep femoral. Inside the leg now, it is the femoral. I never point to that because I think it's actually too easy. But in the leg, if your professor points to that, other professors will point to that. I've seen that. So you should know femoral. And then the three branches of the femoral as you approach the knee. The one that goes to the top of the knee, superior genicular. The one goes all the way down the leg. That's the saphenous. The ones that goes deep to the back of the knee. That is the popliteal. This is the actual correct order. I kind of went out of order there, so I got that. The sap, sup, and pop. The sap, sup, and pop. The sap is for the saphenous, the sup is for the superior genicular, and the pop is for the popliteal. All right? Saphenous, all the way down, it goes past the knee, and it's going down towards the foot. Or it's a cat, so towards the floor. Superior genicular. Genu means knee, so it means goes to the top of the knee. Popliteal, back of the knee. And that's not new to you. You learn popliteal region of the femur. So these are the pictures. Again, I'll point to them on the CAT, so I'm already wasting too much of your time by looking at these. These are cool pictures, but they're not going to help you answer the questions. I do want to, there's colon, there's mesocolon, so what's the one going to the, it's inferior mesenteric. So that's a gimme, you should know that. If you want to see these pictures before you leave, just let me know. All right, then we do this thing here, the white blood cells that you know. And so that's what we do on blood, right? Yeah, pretty much. No, we do typing also. But the white blood cells, I printed this off. I put some photo paper in my printer at home, and I printed this off, and I handed it to the lab specialist and said, can you laminate this for me? I like this picture. Because we used to make you look through the microscope. And what would happen? It wasn't in focus, professor. I had to focus it. They go to focus it and they move the pointer. Well, that sucks. That means everybody behind them gets the question wrong because it's not pointing at the right thing anymore. I'm going to avoid all that conflict. I did it by doing this. The other professors kind of, yeah, I kind of like that idea too. This isn't micro. Now, micro, you're going to have to look through microscopes. When you take microbiology, that's going to be a must. But not here. This isn't the time to learn about microscopy. But you will need to know these cells. So I use a picture of it. You should know that this one here is the basophil. That this one has the red granules, so that is the eosinophil. The two neutrally staining ones are the neutrophils. The one with the brown nucleus in it, this is an agranulocyte, that is a lymphocyte. And the one with the kidney bean-shaped nucleus in it, that is a monocyte. That's not the entire list, but that's all we cover in this class. Do not be surprised that the position of the picture is not just like this basophil might not be down in the right lower corner, it might be up here, or it might be over here. You know, don't memorize the position, please. You should know what they look like. In my class, I identify, why is this thing called an eosinophil? It's stained with an acid-loving dye. The name of the dye, eosin red. In microbiology, you'll learn about eosin red. And eosin red loves to stain to acid molecules. These granules that are in this particular leukocyte are acid. And so the eosin red, so if it's eosin red, yeah, let's call it eosinophil. Guess what's the opposite of acid? Alkali? What's the other word for alkali? Base. This has the granules that are alkali in nature. So methylene blue, fuchsia blue. By the way, you know, these stains, there's a whole darn book of them in podiatry school and medical school. It's called the DIFCO manual. And so there's eosin red, and there's fuchsia stains, and there's fuchsia red, fuchsia blue, there's methylene blue. So I get it, you know. I took micro, we didn't do use. No, I know. There's a whole book of stains. But these are stains where these got their name from. This stain was methylene blue, and methylene blue loves to bind to molecules that are alkali in nature. What's the other word for base? So that's why this thing is called a basophil. The granules in these two here, they take a little bit of both. So they are neutrally staining. And so if you're neutrally staining, what's a good word for that? Neutrophil. That's why they got their names. Eosin red, acid, eosinophil. Basophil, neutrophil, neutrophil. Yeah, there's two, because neutrophils outnumber the other ones, by the way. These are agranulocytes. They don't have those granules that are either acid or alkali, but they have a nice round nucleus lymphocyte. This is small, so there's T lymphocytes and B lymphocytes. You'll get that if you take immunology. And then you got monocytes down here. Monocytes are the ones that morph into macrophages, by the way. They don't stay monocytes always. This is the largest of these. If you don't know how to identify these yet, see me before you leave today, and I'll show you again. I give you this because this one's labeled. You got the L for the lymphocyte and the N for the monocyte, the kidney bean-shaped nucleus. They don't always look like this. Like I said, they change depending on their function at that particular moment. There's a basophil, there's an eosinophil, and there's a neutrophil. The letters have labeled these, so that can help you label what's before this if you don't know how to do that. That's why I give you both of these pictures. This is a blood smear, so all of these other ones that are on here, by the way, these are red blood cells. So magnification could be different from slide to slide. It doesn't matter because you've got a red blood cell that you can compare the size of these two. And that's how you can discern the size of them. Then we do blood typing. In my class, I know there are other professors that use that tray that's on your table here, and they got those little things in there. That's fake stuff, so I don't use that. This is what a real blood typing system looks like in a lab. This is the actual results of a blood type. This is just the control, so you don't have to worry about that. I know most professors do use this one, but some of them use the other. Check with your professor. Are they going to use the actual experiment that was on your table? I don't think that they tried to duplicate what this thing shows, and I think they did such a poor job on it, I won't use it. I'm going to make you do this. This is what negative looks like, where there's no response, there's no reply. So here they put, what is these numbers, by the way? These numbers are 8 different people. There's only 8 different possible combinations when we talk about the ABO blood typing system. There's only 8 possible combinations. These are the important antigens. This is review, so I shouldn't be going over all of this. These are the 8 different patients. These are the 8 possible different blood types. Look at column A and column B here. This is antibody A serum. This is antibody B serum. This tells you whether or not it reacts. This one reacted to A but not to B. So what blood type are they? Type A. Now you look to see if they're positive or negative for RH. This is positive for RH, so this type is A positive. Okay? Let's go down here. This one's negative for A and negative for B. So what blood type are you? O. If you're negative for A and negative for B, you are type O. Negative for A, negative for B, so what blood type are you? O. Negative for RH, so what's your blood type? O. Negative. Okay? So here, negative for A, negative for B, what blood type are you? O. But you're positive for RH, so what's your blood type now? O. Positive. You get it? We will point to 2 of these on your test. Okay, I don't have the picture of the other one on this. If you want to see it, I can pull up my other PowerPoint. I do put it on there just to be complete. But if you need to see the other one, let me know and I'll pull that one up for you. But you should be able to, if I point to any 2 of these, you should be able to tell me the blood type. Did you notice what I did? I looked at A and B column first. That keeps it simple. That's the way this is developed, by the way. Blood typing only did A and B in the beginning. It wasn't until later on in Africa, there was British colonists, I believe it was South Africa, could have been the Congo, somewhere in there. They were experimenting on monkeys. And the name of the monkey, the rhesus monkey. R-H-E-S-U-S, and that's why it's called RH, for that monkey. That's why it's called RH. And they found that out later. And then they say, well, look at that. Not only does the rhesus monkey have this antigen on it, but so do we. By the way, it's the most common RH in this country is RH positive. Most of us in this country are RH positive. There are some that aren't, and it could lead to trouble. That's for the class stuff. Any questions? I did enough. This is supposed to be review.